If you're pregnant or planning a family, there are some things you should know before you give birth in Arkansas. Health experts are sounding the alarm.
It's a crisis anytime we have a maternal death, right? And so what we know about maternal health is this country, for a developed country, we have some of the worst statistics in the world. And Arkansas as a state is leading in not a good way.
Dr. Gloria Ríchard-Davis's assessments are spot on. Numbers compiled by nonprofit Every Mother Counts show that Arkansas has recorded about 45 pregnancy-related deaths per 100,000 births. For context, the nation has recorded just 30 pregnancy-related deaths per 100,000 births. Dr. Ríchard-Davis points to a number of factors for the massive health disparity.
We have a shortage in the state of obstetrician gynecologists, as well as a shortage of delivering hospitals. So the access is constrained for many patients. We have telehealth, where we have bridged some of the gaps, but really the biggest gap that telehealth bridges is high-risk OB consultations. It doesn't really bridge that low-risk access, right? Mm-hmm. Because if you have to travel 2, 3, 4 hours for a visit, many patients either don't have transportation or they can't afford to be off work. That would be an entire day.
The gaps seem plentiful and impossible to solve, but in come Black women ready to work and find solutions. The Ujima Maternity Network, founded in 2018 by Nicolle Fletcher and Sarita Hendricks, are here to fight Arkansas's maternal health crisis.
So we understand that this work is not going to get better from just one entity changing, right? It's going to take all of us working collectively, every area or every aspect that touches maternal health care, working in collaboration with others to be a part of the solution and to fill in those holes.
Ujima provides connections to doulas who come alongside doctors and parents to provide non-medical, emotional, physical, and informational support, as well as staunch advocacy for moms during preconception, pregnancy, labor, and postpartum life. And the way they care for mothers sometimes encourages women to join the fold. Meet Ruby, a birth and postpartum doula trainee with the Ujima Maternity Network. She will be the first doula in the group to offer bilingual services to the Hispanic community. Ruby says her personal negative birthing experience is driving her to provide help to her community. She recounts sharing her birth plan with her OBGYN.
I took him my birth plan. He immediately started crossing things out, you can't walk around the room, you can't take a shower, you can't, your boyfriend can't cut the umbilical cord, I get paid to catch the baby. Your boyfriend can't be near, the baby, because that's what I get paid to do.
Rising tensions forced Ruby to end her relationship with the physician, ultimately choosing to have a home birth supported by Ujima. Acevedo says a safe and successful delivery left her feeling empowered and ready to empower more women in her community to do the same.
I want to be able to help them learn, I guess they have a say, even though they're in a different country, that they don't need to feel intimidated by not wanting to do things the way a doctor does. They're used to different practices, and I want to make sure they can still have that part of their culture involved in their birthing experiences.